Okay, in this video I'm going to discuss how I approach cases of hip impingement where moving into the restriction in an attempt to improve range of motion actually makes symptoms worse. For instance, trying to stretch into hip flexion and internal rotation, just causing further jamming and increased pain symptoms and not actually relieving. There are plenty of cases of hip impingement where you do have to move into the restriction, and though it might start off a bit pinchy, it actually becomes a bit more relieving. So in this case, you may be thinking you're doing all the right exercises that therapists and coaches promote online, including me, but you're just not feeling the exercises in the right way or the same way you do on your non-affected side. And the basic idea is you can't move where you're already stuck. So I see it very often where somebody might be limited in internal rotation on one side, but it's because the pelvis is already in a starting position of internal rotation and turned toward that same side, so there's no room for the femur to actually rotate further inward. And this tends to be in somebody who favors their dominant side with single leg activities. So in order to actually improve internal rotation in this case, we need to create the space to move into internal rotation by ensuring the pelvis is starting relatively in the opposing direction, which in this case would be external rotation. We can drive this rotation at the pelvis two ways. One is at the rib cage, where we influence trunk musculature such as the obliques, or we can go from a bottom-up perspective and utilize muscles such as the glutes, which will help turn the pelvis the other way. So we can use a supine trunk rotation test to get a better idea of what side the pelvis is turned towards. If I have a pinchy hip and I'm able to turn my lumbar spine and pelvis toward that same side better, that tells you that you're already turned and shifted into that side. Now in my case, I have a history of having more impingement on my right hip, and I'm able to turn my knees toward that right hip much better than I can my left. You want to be very precise with this test and go extremely slow. Once you start rotating your knees toward the ground and you start to see the shoulders lift off the ground like you see here, the test is over and you moved too far. We want to see how far the pelvis rotates before the rib cage and the shoulders are moving along for the ride. We can couple this with a quadruped thoracic rotation test, and we may notice that we turn our rib cage worse toward the opposite side, which had better pelvic rotation. One of my favorite stretches to improve the ability for the lower trunk to rotate to the opposite side is this 90-90 oblique stretch. The external oblique turns your trunk toward the opposite side. So as I am rotating toward the same side, this relatively places my lower trunk and pelvis toward the left. A lot of times people complain of jamming on that opposite hip, so you need to make sure you're actually shifted away and creating a side bend, in this case toward the left. Since the obliques work to posterior tilt the pelvis, in order to properly stretch them, we need to be in an anterior tilt. I'm applying a contract-relax cycle here, where I drive my left hand into the outside of my front knee, and then relax, and then try to rotate further. I can even pick that knee up, which will turn that pelvis more toward the left as well, and I should feel an even deeper stretch through the side of my trunk and kind of in the anterior insertion of the oblique in the front of the hip. Another strategy here is a side-lying thoracic rotation with hip shift, and this is more of a rib cage focused strategy. I'm going to lay in side-lying with a foam roller in between my knees, and in this instance I'm rotating my rib cage slightly to the right. And now, instead of trying to rotate further through the rib cage, I'm just going to shift my top knee forward over the bottom knee, and we should feel a much greater stretch occur at that lower trunk oblique region and through the upper part of the rib cage thoracic spine area between the vertebrae. So as I pull my top knee further over the bottom knee, this rotates the lower trunk to the opposite side that the rib cage is rotating towards. This is why if you had a harder time rotating your knees toward the right in the supine trunk rotation test, you would want to do this with the thoracic spine rotating to the right, so that we can focus on getting pelvic and lower trunk rotation over toward the left. Okay, this next exercise is going to be a box-supported stride stance hinge with a bent knee for more of a glute focus. Now, if you get a pinch with rotating the pelvis toward the same side that you're hinging towards, then this could mean that we need to actually turn away from that same side to give ourselves space to internally rotate into. Typically, turning the pelvis toward the same side as we hinge will bring on more length through the glutes in the transverse plane rotationally so that we can improve hip flexion and internal rotation. But in this case, I actually want to turn the pelvis away so then I have space to actually flex the hip and improve range of motion through the sagittal plane. So in this drill, I'm doing dynamic reps here, keeping the back leg long to influence more of an anterior pelvic tilt and direct hip flexion. I can use a weight held on the ipsilateral side, so the same side, which will also help turn my pelvis away. And that tension through the femur will actually allow myself to have space to hinge the torso and the pelvis over top of it. Over time, once symptoms decrease, you can use a contralateral grip, which will influence more of a pelvic shift and turn toward that same side. Here you can see that ipsilateral grip will force me to keep my knee out somewhat, so we have a contraction of the glute in the transverse plane, compared to here, adducting the knee, which will bring more length into the glute in the transverse plane. Of course, over time, once symptoms start to decrease, you can use more of a contralateral grip and influence more of that adduction and internal rotation from the femur. Lastly, we have an open chain hip internal rotation liftoff and side lying. What we typically see here for people limited in internal rotation is a pelvic hike on that side, where we just use a lot of low back to create internal rotation that we don't actually have at the femur. So what I like to do is place a towel roll or some sort of object underneath the ribs on the bottom side, which will side bend us toward that downside and prevent that pelvic hike. Now what you'll see here is I shift that top knee forward over the bottom knee before performing these liftoffs, and that creates that pelvic turn away from the side that we're rotating the femur, again giving us space to rotate the femur internally on a relatively externally rotated pelvic starting position. And then of course as we progress, we can pull that knee back, which will influence more adduction and internal rotation of the femur over time. Okay, and here's how I would structure a hip impingement rehab plan around these drills. So we would start with a superset of the trunk-focused work, getting the rib cage to rotate better to the opposite side. With the 90-90 oblique stretch, we're doing 3 cycles of 5 and 5-second contract-relax, where we contract toward the opposite side, relax, try to anterior tilt the pelvis further, and relax and move deeper into rotation. And we're pairing that with the side-lying thoracic rotation with the hip shift. Remember, we're moving that top knee further over the bottom knee, and just constant motion here, moving that top knee further over the bottom knee and pulling it back. And then we move on to the stride stance glute hinge, and I indicated an ipsilateral dumbbell grip. If you are very symptomatic, you don't even need to hold the dumbbell. You could just simply turn your torso away from that stretching side hip. If you are very symptomatic and turning your pelvis toward that stretching side causes more of that pinch, then you're going to have to stay turned away for quite some time. Over time, when we do this drill, we can progressively overload with a dumbbell held ipsilaterally. And then as that stops becoming so symptomatic, we can start to turn our pelvis more neutral while still holding that ipsilateral dumbbell grip. And then eventually we can move on to the contralateral grip with the dumbbell held in the opposite hand, which will actually turn our pelvis toward that stretching side, bringing on more length to the glutes. But we shouldn't feel any pinching at this point. We should just feel a clean stretch and lengthening in the back side of the hip and hip capsule. And then lastly, we'll finish with the side-lying internal rotation lifts. Remember, pulling that top knee over top of the bottom knee, creating that external rotation, and we're doing high repetitions here with a hold at the top each rep. So after performing this sequence, we should see an increase in hip internal rotation because we improved the ability for the pelvis to turn the other way, which gave us more space to move into internal rotation through the femur. Okay guys, that's the video. If you found it helpful, leave a comment, like the video, and subscribe to the channel if you haven't already. Hip impingement cases are very individual, and there is no one-size-fits-all reason for why somebody develops hip impingement, and the fix should be very individualized based on an assessment. So if you do want an individual approach for your hip impingement, please reach out and we can have a one-on-one assessment and discuss online coaching options.